typical right now. Where's everybody? Just decided they weren't going to come today. That's feeble. All right. This is the. Oh, that's fine. This is the sheet that summarizes the responses comparing males and females. So on the front side is the immediate response to an acute bout of exercise, and on the flip side are the training responses. All right, so that I think will help kind of summarize everything in one place for you. All right, I didn't get quite as far with planning. I wanted to cover one other topic that I didn't get a chance to do, but we've got some good info, I think, to look at for the last lecture. Hopefully, this will give you some ideas about different populations that you might come across, particularly if you're teaching. Less likely with some of them if you're coaching, although not all of them, and if you're personal training, you might come across as well. So the first one, I wanted to look at asthma because particularly around here, a lot of people suffer with clinical asthma. Some people have asthma type allergy issues, even if they're not true asthmatics, you see some similar symptoms. So because we've got, especially with the dust and everything around here. So asthma is defined as labored breathing, wheezing, and a tightness in the chest. And it's caused by the smooth muscle in the airway contracting and restricting narrowing the air passage, so the air can't get through to the lungs. So we see constriction in the bronchial tubes before the lung tissue. And it's triggered by allergens. That can be, it can be animals, but it can be things like ragweed. It could be in movement scenarios. You could be looking at the emissions from the chemicals used in a swimming pool or at an ice rink. The chemicals that they use when they smooth over the ice, those can cause a problem for some people. So lots of situations where we think about moving and being healthy can cause a problem for individuals that suffer with asthma. If we're doing PE outside on the playing field and it's windy, I have trouble. Last week when I drove to Lubbock, I'd been really struggling for a while with allergies, and I didn't know what it was, and then I drove past the cotton fields like, oh yeah, honestly, cotton, I had trouble. Because that was always the time in Alabama when I had trouble. So, it being windy and things carries allergens. So you might have kids in your class, or athletes if you're an outside sport that have particular problems. Possible other factors that can lead to asthma attacks, obesity and decreased physical activity, because both of those result in a reduction in the diameter of the airways. So then if you add the asthma on top of that, we've got a bigger problem. All right? You may hear the term EIA. EIA stands for exercise-induced asthma, and so some people aren't generally asthmatic, but when given the trigger of high-intensity exercise, they develop asthma-like symptoms and attacks. So that you've got to watch for that, because this could be an individual who, in other contexts, does not suffer with any asthma symptoms at all and would not have been diagnosed as asthmatic. So they may not have the medications and things to help them deal with that attack that comes with exercising. So let me see, what was I going to say? Oh, so typically you'll see EIA within about a quarter of an hour after starting the exercise, particularly if you're going, transitioning into a cold environment quite quickly and then asking them to go play on the playground or do something like that, then that can cause the problem. The increase in ventilation, so as I start breathing faster at the beginning of the exercise, then that dries out the inside of the bronchial tubes and means that you're moving cold, dry air through relatively dry bronchial tubes, and so that can trigger the attack in a exercise scenario or a PE scenario. So they get a sudden bronchoconstriction because of the cold and the exercise. Masks, so little face masks, can help with that, particularly in the cold, because they help to humidify and warm the air up. Just wrapping a scarf around your face can help, particularly if you're doing winter sports. So if you're going to go skiing or cross-country skiing or just hiking in the snow, then you want to be aware that wrapping the scarf around may help someone who's struggling and wheezing a little bit. Preventative measures, so you can use pharmacological measures, so corticosteroids inhalers. Not all inhalers have steroids in them, but many of them do. So you do have to be kind of careful. If you're an athlete, you've got to be careful with inhalers because most of them are on the banned lists. So you would have to have approval and permission to use your inhaler. They might use bronchodilators or some kind of inhibitor to stop the muscles from constricting and narrowing the airway. So there are several different kind of measures that can be taken to try to help. Things that you can do to help people in your classes or your athletes who are not or don't want to take their meds, or to supplement the meds. A really good warm-up particularly includes some short, intense, high-intensity type things to increase the flow of epinephrine, norepinephrine, corticosteroids, because those act as bronchodilators. So a good warm-up helps the bronchial tubes to dilate and counteracts the constriction a little bit. So it's really important that you include a good warm-up make sure that they cool down properly. Try to avoid allergens as much as possible. So if you're going to go to the swimming pool, can you find out from the people running the pool when they add the chemicals to the water, and time the visit to the pool so that it's not straight after the chemicals have been put in and there's been some chance for the emissions to disperse, and maybe that will then prevent a reaction to that. Exercise and being physically fit do help. Historically, when I was young, they used to tell people with asthma not to exercise, period. Because it would make it worse and they wouldn't be able to breathe and blah, 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 right? But nowadays, that's not generally the case. They'll encourage someone with asthma to exercise because A, we've got the concomitant health benefits that we know about, but B, what you see is that the more exercise they do, it kind of helps the bronchioles to stay dilated. You just got to be careful, make sure that you've got your meds to hand. And if you have a look at if you have a look at page 486, there's a box there that specifically gives you some strategies for working with children who are asthmatic and giving you some ideas there. The more aerobically fit someone with asthma is, the lower the ventilatory load when they exercise. So the fitter I get, the less stress there is on the respiratory system to deal with getting oxygen into the bloodstream. So the fitter I am, the less load there is on ventilation, and so that actually in the long run benefits someone with asthma. You've just got to be a little careful in how do I program getting them fit enough in the first place that you see these benefits, right? Because they are going to struggle maybe with getting oxygen into the bloodstream where another individual is not at that level, all right? ACSM gives some tips for you. I've put up a fact sheet on Blackboard, so make sure that you access that. You want to create a little portfolio of information that you can use as a resource when you're teaching, because you never know when you're going to come across an individual that would count as a special population. You know, we see there's many more people with asthma now than 30 or 40 years ago. So why is a whole other discussion. My personal belief is it's to do with things that are going on in the environment and pollution and things, but I don't have the background in the reading to know for sure that I'm right. But we definitely see a larger number. Could be that we're better at diagnosing it, right? So, but there's a lot more. Chances are, if you're going to be a PE teacher, that you certainly will have children in your classes over time who are asthmatic. Right? Epilepsy, you're way less likely to work with someone who's epileptic. It's only about 1% of the population in the US has epilepsy. So it's a relatively, I mean, that's a lot of people because you're such a big country, but it's a relatively small number of people. People with epilepsy have recurring seizures, and obviously if someone's going to have a seizure in the middle of your PE gym, then you've got to have some awareness of how to deal with that seizure. Generally, epilepsy is believed to have a genetic foundation, so it's not environmental, it's all to do with genetics. And the seizures can be triggered by several different factors. So things like fatigue, smoking and or being in an atmosphere where there is smoke, flickering lights. So if you've got tube lights in your gym and one of them is going out, that can initiate a seizure. If the individual has a lack of sleep, so if they're tired, that can cause a seizure to happen. But also stress, and physical activity is a stressor, so it can be a factor in developing a seizure. Moderate aerobic exercise has been indicated in reducing the incidence of the seizures. So about 40% of epileptics who do exhibit seizures see a reduction. So it's not a great number, but anything is better than nothing when you're in that population, because seizures can just occur at any time. So it really impacts quality of life and your ability to go out and work and take care of yourself. You don't want to do high intensity, exhaustive type work with someone who's diagnosed with this. But exercising regularly does help with, it decreases cortisol, which is a stress hormone which is connected with the seizure. It increases beta endorphins, opioids, those feel-good things, and that can, just the whole feeling better decreases stress, and so that can help with seizures. There's also been some indication that it helps with concentration, and obviously other health benefits, lower chances of cardiovascular disease, less chance of developing overweight, all the typical things that we've talked about during the semester. It's really important that that they're in a relatively safe, so doing things like football where they're going to be banging their head around probably isn't a good idea for someone with epilepsy, right? And if they seize, you'd like them to be in a relatively safe, like, are they going to hit their head on a hard floor or hit their head on a piece of equipment, right? Can you manipulate the environment to make sure that they're as safe as possible? The meds that they use for epilepsy can cause some visual issues, so the vision might be a little blurred perhaps, or their depth perception might be affected a little bit, which you could see as a lack of coordination, maybe. They also do decrease bone mass. So that's another argument for trying to do some weight-bearing exercise to try to counteract the loss in bone mass. Right? Okay. So, ADHD, particularly if you're a PE teacher, but I suspect even if you go into coaching, you are going to come across individuals with ADHD. Right now, the estimate is around 7% of school children are ADHD. Some of the symptoms that you see are inattention. They do tend to be classified as aggressive, which I think is a shame. I haven't had a lot of experience working with ADHD kids, but the ones that I have, usually my personal experience, when I watch them, when they're aggressive, it seems to be driven by frustration. because they're not good at making themselves understood. Their social skills are generally very poor. Their academic level is generally below normal for their age group. And so they struggle to articulate what it is they want to do. And they don't have very good strategies for dealing with other people and or their frustration. And so they get angry and then they get aggressive. But I would caution, be a little careful about identifying them as aggressive, because aggressive to me means someone who is deliberately going out to hurt somebody. And maybe that's just my personal interpretation, but that's how when I read the word aggressive, that's what that means. And I'm not sure that that's always the case with this population. They just get, it's like a 2-year-old who can't tell you what they want and they throw a tantrum, right? They are very disruptive. If you've got them in a regular class setting, they can be very disruptive because they're not good at following rules. They're not good at following instructions. They don't listen well. They can't sit still. It's just, they make life a little difficult. But the challenge can be really fun as the teacher, especially in PE, because they don't want to sit down. Right? You're not going to have an ADHD kid in your class who wants to be sedentary. So how do I manipulate that to be beneficial rather than disruptive and negative? Right? They're very impulsive. They're not good at controlling. So if they want something, they will go and get it, and that might involve taking it from someone else. And if you remember back to the playground when we were in 212, we have to spend a lot of time talking about sharing and not snatching the toys. It's kind of like that with ADHD, even if they're 10, 12, 14. Okay? As I said, they do tend to have problems making friends. You do see poor academic performance. They're generally, on average, somewhere around 2 years behind cognitively their equivalent aged peers. So that 2 years makes a big difference in the classroom and with their play and social skills. Less than 5%. So if you look at the general population, you're looking at, these days, quite a high, probably 30% or so of the adult population get a college degree. 25%, I think, somewhere around there. It's pretty high now in this country that get a college degree, may even be higher than that. When you look at this group, less than 5% of this population are going to graduate with a college degree. So that's an indicator of the issues that they're trying to deal with, all right? So they're always kind of behind the ball a little bit. They also, around 50% of ADHD children exhibit poor motor coordination. So their motor skills are also, so they're delayed academically, they're delayed socially, they're also delayed motorically. So, you know, they're quite a challenged group of children. It always presents itself during childhood, and then it will often persist right through adulthood. So it's not like they grow out of it. The problems are there and they've got to learn strategies to deal with it. It's 3 times more common in boys than it is in girls. So that can be problematical if you're a female PE teacher, because, you know, depending on which age group you work with, the boys are going to be a lot bigger than you, probably. How are you going to set up PE to help them and benefit them rather than hold them back and keep them out of the game. So what often happens with ADHD, rightly or wrongly, is that they will give them psychostimulants. So Ritalin is the one that most people have heard of. Because the area of the brain that's responsible for cognitive functioning is controlled with psychostimulants. So they give them Ritalin and other different kinds of meds to try to normalize that area of the brain and the way it's functioning. So the exercise then releases catecholamines, our epinephrine and norepinephrine and others, that also target that area of the brain. So there's some research now, and there's some indication that if we can get them to exercise on a regular basis, that we can use exercise to help them control behavior and help them be more academically successful because they're sitting still and they're able to pay attention in class. Rather than, or at least in conjunction with, a lower dose of psychostimulant. And there's lots of benefits to that because the psychostimulants bring with them long-term health risks, such as hypertension, glaucoma, so it can affect their vision. It can lead to cardiovascular disease. It can affect the thyroid. So the meds that they put them on to try to help them control their behavior have some pretty severe long-term health implications, which obviously exercise doesn't. It has very beneficial long-term health implications. So if we could transition to using more exercise and less meds, that may give them better outcomes as they transition into adulthood and older adults. Plus we see increased blood flow to the brain, so there's more nutrients, there's more oxygen. There's some indication that exercise will stimulate synapse development. So there's all kinds of win-wins if we can get ADHD children into good, developmentally appropriate exercise programs. The meds they're on, because they're psychostimulants, do just the same thing as epinephrine would do. We see increases in heart rate, increases in blood output, cardiac output, increases in blood pressure, temperature, all right? So all of those things are considered ergogenic if I'm doing performance, and that leads to the fact that psychostimulant use is banned by practically every organization that's in charge, that's in governance of any physical activity or competitive sport. The NCAA will allow athletes to use their meds as long as they've got documentation from the clinician, and that documentation is updated every year. So in the NCAA, your athlete who is ADHD may be okay, but to my knowledge, you can't compete at international level or any of those things and use those psychostimulants. So you've got to have other strategies for controlling behavior if they're competing for world championships or Olympics or anything like that. Some of the issues, so if you're working with individuals who are taking these medications, then a couple of the things you want to be aware of to look out for. Using the Ritalin or any of the other medications blunts the pain response. So they may get hurt and not know they're hurt. Or they may not realize they're as badly hurt as they are. So you may need to step in and pull them out. They often affect appetite, which makes it difficult for them to maintain weight. So if they're doing a really quite intensive exercise program, then they struggle to maintain weight because they can't eat enough calories to keep the seesaw in balance, right? There isn't, surprisingly, any, the literature review doesn't indicate a link with sudden cardiac death, which is surprising given the elevations in heart rate and blood pressure and all the others. But there doesn't seem to be any link with any higher risk of sudden cardiac death than for a typical person, right? Probably the biggest issue that you're going to have is the fact that core temperature can go up quite significantly, and so they're at greater risk of developing hypothermia. So if you're working with them and you're going to go outside and be on the playground on a hot day, then you need to keep a better eye on them, make sure that they're fully hydrated, all the normal stuff. But they are at a greater risk than your average PE student will be, or athlete, right? Children with ADHD who do PE and exercise regularly see significant improvements in attention, which translates into better school performance. So generally, you'll get quite a lot of support from parents and school teachers to involve these children in PE or after-school activities and things like that, whatever you've got going. Hopefully, we'll get to a point where we can understand the impact of exercise well enough that we can start to use exercise more than medication. That would be great, but we don't fully understand how well we can use exercise to manipulate their behavior yet. So, most of them will be on some form of medication. Symptoms, as I said, poor attention span, generally. So if they're in your class, they'll be, not watching you while you're demonstrating the skill. So they tend to miss out on the modeling. And then they pay attention to things that you don't expect them to. So if you introduce a new piece of equipment, they'll be absolutely fixated on that piece of equipment, and they'll want to experiment and test it and examine it and really get to understand it. Most of them are connected to this attention span idea. They're not good at standing in line waiting for a turn. Well, hopefully by the time you finish the program, you'll know that that's not a good plan for your PE class anyway, right? Even for someone without ADHD, we shouldn't have them standing in lines waiting for turn in PE, because then they're not moving, and then PE isn't doing what it's supposed to be doing, right? So the whole waiting for a turn is out the window anyway if you're using your class time appropriately and you're setting up good lesson plans. All right, I didn't get to do that. I really wanted to talk about autism spectrum disorder, but I didn't get there. So, it's another group of people. If you are a PE teacher, there's nowadays very little chance that you're going to go through your career without several cases of children who are diagnosed somewhere on the spectrum. So again, in the past, autism was autism. Now autism is autism spectrum disorder because there's a whole range of different kinds of behavior issues that fit under that umbrella. So they could lie anywhere on the spectrum, and so the range of different behavior problems and different symptoms is quite varied. All right. As always, so far, exercise seems to be beneficial. Yay! And yet, we're getting rid of recess and PE. There's no sense whatsoever to what is going on in education at the moment with movement, because there's nothing to support anything that they're doing. Down syndrome was the last one that I wanted to have a chat about, because Down syndrome children are really fun to work with. They are heaps and heaps of fun. They're very rarely sad. They're always happy. They're always smiling. They love to hug and cuddle. They're just the happiest little group of children to work with. They're a load of fun. And nowadays, I think beneficially, they integrate children with Down syndrome into the regular population for school. When I first started coaching, that wasn't the case. They would be in a special needs class and they would be separated from the typical population. But that's not the case anymore. They integrate them and they have very good outcomes in a typical class. So again, if you're PE teaching, it's possible that you could have a child with Down syndrome in a class. Down syndrome is a problem with the 21st chromosome, so technically it's called trisomy 21. And there's nearly 500,000 people at any one time in the country, so again a relatively small population, but doesn't mean you won't have interaction with them. They do often exhibit congenital heart defects. They sometimes will have hearing problems. They have very soft muscles. So their muscles are really never tense in the way that you guys have. So that tone, even when you're just sitting there, the muscle tone in your core muscles is very strong and tight. They don't tend to exhibit that. So they are a little bit kind of wobbly when they're moving around. They have trouble with tightening the muscles around their hips. So their walking pattern and their running pattern tends to be quite wibbly-wobbly, right? Because they've not got the control that you have over the postural muscles. Let's see. Life expectancy used to be late teens, early 20s, now into the 50s. So the change in strategies and how the society manages people with Down syndrome has led to much longer lifespans, which is lovely, I think. Depending on the level of Down syndrome, because some people have a very mild case and may be able to be almost fully independent, have their own place to live, to people that cannot be independent at all. They can't really make good decisions or take care of themselves. Exercise then with this population helps keep their muscles stronger, helps to teach their brain how to coordinate some of those postural muscles, so it often will help with their walking pattern and just their overall posture improves. Cardiovascular fitness, they do have these heart defects, but it will help the heart stay strong. They sometimes will struggle with following directions, so you have to make sure that you make eye contact and give them very clear directions. Things like swimming, dancing, they love gymnastics. I've worked with a couple of Down syndrome gymnasts, and they just love to move around and show off and be the center of attention. They're very theatrical in my experience. They really like people watching them do something. Don't do too much that is kind of long duration endurance stuff. Keep things more like intervals. Games are good where it's stop-start and they get to have a rest. You've got to be careful with the, let me get this right, because atlantoaxial instability, it's very difficult for me to say. So they will often have instability at the top of the neck here. So if you've got Down syndrome children in your PE class, then you should have neck x-rays on them. If you're going to work with someone as a personal trainer or anything like that, or if you work at a recreation center and you have people with Down syndrome coming to the recreation center, you really should check their doctor's notes, have a look for this neck x-ray, because if they exhibit the instability, there are things you definitely do not want to do. Nothing with any hard contact. I used to have a little child that came trampolining with me. So obviously, if they've got that instability, I can't put them on a trampoline. Well, you guys don't have to worry about trampolines because your country kind of got rid of trampolines, which is really sad because they're the most fun. But, you know, anything maybe little, if you've got little trampettes, things like that, nothing, if there's any chance of head wobble or head impact, not with someone with a negative neck x-ray, right? Other than, not all of them exhibit that. So if they're not exhibiting that, then you've got a little bit more flexibility on the kinds of things that you can do. But obviously swimming or any kind of aqua aerobics is ideal for that population. So you want to increase muscle strength and do as much cardiovascular fitness work as you can to benefit the issues that they have due to the syndrome. So they're so much fun, a lot of fun. So far, what have we found out in the semester where exercise is negative? Nothing. Right? So when you go out into the general population, you've got to find a way of making exercise accessible and fun. Because there is nothing there. All right, Friday, today's Wednesday, right? Friday is review day for exam next week. All right, so make sure that you've looked at these chapters, come with questions. I'll set up some review play. We'll have our final competition. Can team back in the classroom win again?